Thank you. Kia ora, and welcome to another CIICA Live event. I'm Holly Teagle from the University of Auckland and the Hearing House in Auckland, New Zealand. Thank you all for attending all around the globe, and a sincere thanks to Sue, Brian, and Leo for their sustained efforts at keeping CIICA and our important aims foremost in our minds. Next slide, please. I'm not sure that the speaker view is showing, is it? Yeah. All right, here's our program for today. We're going to hear from our global partners about their contributions to the cochlear implant living practice guidelines. And all of these folks offer a unique perspective, either as a hearing healthcare provider, a cochlear implant recipient, or a family member who supports a cochlear implant user. And all have contributed to the development of the living guidelines. These united efforts are going to make a huge difference in the availability and uptake of better hearing healthcare. Next slide, please. So the overarching aim of CIICA is to close the gap in cochlear implant provision and ensure lifelong support for all who can benefit. And the living guidelines have really become a vehicle for us to extend the work of CIICA. The project goal is to create living guidelines and that can be adapted and adopted for each country around the globe in order to optimize the care for adults and who is eligible, those adults who are eligible for a cochlear implant. A key aspect of the guidelines is this living concept, and that is that the practice guidelines will be updated as new evidence emerges in cochlear implant research and evidence-based practices that support these guidelines. This includes work from clinicians and scientists, and importantly from consumers and their families. Next slide. It's been a Herculean effort to engage with people all around the world and to drive this consensus. And we know that every country has different challenges and assets, and that will affect the delivery of hearing health care. So the work has been supported by many of you at this point, but really we'll have to keep working to extend it to all as we continue to make progress. So for those of you who may not be as familiar with CIICA or need a refresher, these guidelines were based on clinical and research evidence, and that's the foundation of the living guidelines. And to that end, over 13,000 studies were considered that will develop the platform. If the evidence for a specific topic was not sufficient, or it wasn't agreed upon by the hearing health experts that were recruited to work on this important task, then the recommendation was revised and altered until there was consensus and a greater agreement was achieved. So this phase of the guideline development is now complete, and we're on to the public consultation phase, which you see in this slide here. Now that this phase is ongoing and just recently completed, we're anxiously awaiting the publication of the final document. Efforts have been made to incorporate the voices of cochlear implant and hearing healthcare communities. And while this is a huge accomplishment, it's just the beginning of the jobs that we have ahead of us to implement this work. The adaptation and the adoption of the guidelines must be shared with government entities, with insurers and general healthcare providers. It cannot just live in the community of hearing, of cochlear implant recipients and hearing healthcare. We have to share it with general practitioners and medical specialists, educators, and the wider community so that people really know that hearing health means better quality of life and better opportunities for people. So next slide, please. So this is, as mentioned, we've got some topics, questions that we're really, we're going to drill down on today. And these are some of the responses from the CIICA conversations that fed into the document. The first one here, if you advance, please, is that cochlear implantation should be part of the lifelong hearing journey. And this means that referral processes have to be improved so that many healthcare providers who are not making that referral and may be unaware of who and where and when to refer a person, has the information so that we can give them full access. Assessments and their purpose should be clear to the users and families and reflect the functioning. These are some of the statements. Next, advance, please. These are some of the statements that support this, this purpose. So the both for candidacy and for ongoing assessments, we want people to be able to engage and that the testing that's done is meaningful to the cochlear implant user or candidate. So it's important for users to understand how they're performing and if they have additional rehab supports that will help. And then the next one that's shown here is that peer groups have major role to play before and after, but they do need guidance. And so these statements, these two statements here, support the importance of peers and that they really are important in all phases and help people with significant hearing loss know that they're not alone and that they can share their unique perspective that may be different from some of our healthcare providers. The next quote here is that rehabilitation should include counseling and coaching can be key. And the role of rehabilitation has always been recognized as essential for care with children, but we've really not maybe given it the credit that it deserves with adults. And so part of rehabilitation is addressing the mental and the emotional health needs of people who live with significant hearing loss. And then finally, the relationships and family dynamics that can change when a person loses their hearing and regains hearing. And there needs to be recognition and support for these changes. And that's the last point on this slide. Relationships and dynamics of the family change a lot. So as we move forward and we hear about from our CIICA partners today and carry this project forward, we need to think about innovation, collaboration, and efforts to think globally and act locally. And our CIICA community will be working to sustain and further these efforts and improve hearing healthcare for all.